We are going to discuss about Naproxen and Mefenamic acid. Our group members are Afika, Fatiha, and Shahira. The contents included drug profile, patient counseling points, conclusion and recommendations, references, and teamwork.
Both drugs are non-steroidal anti-inflammatory drugs. Mefenamic acid has shorter half-life and need to be administered more frequently, usually 6 hours. Naproxen can be used less often, usually twice daily.
For the drug classification, both Naproxen and Mefenamic acid are belong to the group of non-steroidal anti-inflammatory drug, which is NSAIDs class.
Mechanism of action. Although mechanism for both drugs are not fully understood, it might entail the reversible inhibitions of enzyme cyclooxygenase 1 and 2, COX-1 and 2, which reduce the formations of prostaglandin precursor.
So, what are their therapeutic indications and clinical uses? Naproxen is indicated for acute gout, tendonitis, ankylosing spondylitis, rheumatoid arthritis, osteoarthritis, mild to moderate pain, and many more. While for Mefenamic acid, it is indicated for mild to moderate pain, osteoarthritis, rheumatoid arthritis, menorrhagia, primary dysmenorrhea, and fever. For the clinical uses, Naproxen is used for the treatment of acute gout attacks, relief of pain due to muscle injury, back pain or trauma, management of painful menstruation, while for Mefenamic acid, it is used as the first-line option for menstrual cramps, short-term relief of dental pain, muscle pain, or post-operative pain, occasionally used to manage heavy menstrual bleeding, and suitable for short-term musculoskeletal pain.
Naproxen is absorbed rapidly and fully from the gastrointestinal tract. Naproxen sodium is absorbed more quickly. It also has reduced absorption with food, but not to the same degree. A small amount of naproxen crosses the placenta and gets into the breast milk. It is also metabolized by the liver to 6-O-desmethyl-naproxen. And finally, naproxen is excreted via feces and urine. Pharmacokinetic of Mefenamic acid. It is absorbed rapidly from the gastrointestinal tract. Distribution. A small amount of Mefenamic acid gets into the breast milk. It is metabolized to form 3-hydroxymethyl-mefenamic acid, which then further oxidized to 3-carboxy-mefenamic acid, excreted via feces and urine.
What about the patient counseling points?
For Naproxen, for pain and inflammation in rheumatic diseases, Naproxen should be taken by mouth. They should take 0.5 to 1 gram daily in 1 to 2 divided doses. For pain and inflammation in musculoskeletal disorders and also dysmenorrhea, initially 500 mg, then 250 mg every 6 to 8 hours. Over-the-counter Naproxen should only be used temporarily if the pain lasts longer than 10 days or the fever lasts longer than 3 days. It is best to stop taking the Naproxen and see a doctor. Next, for the Mefenamic acid, first is the pain and inflammation in rheumatoid arthritis and osteoarthritis, post-operative pain, mild to moderate pain. It should be taken by mouth, 500 mg, 3 times per day. Acute pain including dysmenorrhea and menorrhagia, it should also be taken by mouth. For children which age 12 to 17 years old should take 500 mg for 3 times per day. For adult patients, they should take 100 mg 3 times per day. First, for Naproxen, the patient might having headache, so it is advised for them to get enough sleep and also stay hydrated. They also should limit their alcohol consumption and also seek advice from pharmacists regarding pain reliever. Now, for the potential side effects effect and how to manage it for the mefenamic acid. While taking mefenamic acid, the patient might have excess air or gas in the stomach or intestine. So, it is best for the patient to take mefenamic acid with food in order to reduce the effect. Contraindications and precautions. For naproxen, there are a few contraindications including documented hypersensitivity to NSAID medication, ASA and NSAID induced asthma, and also pregnancy. For the precautions for naproxen are hypertension, congestive heart failure, fluid retention or edema, and also dehydration. For mefenamic acid, the contraindications are hypersensitivity to mefenamic acid, aspirin or other NSAIDs, inflammatory bowel disease, severe heart failure, pregnancy during third trimester.
Next, for drug storage and handling, both drugs should be stored in a closed container at room temperature, away from heat, moisture, and light. For the handling, both of drugs should be kept out of reach of children. Do not use beyond the expiry date.
Conclusion and recommendation. In summary, naproxen and also mefenamic acid are both essential non-steroidal anti-inflammatory medications for the treatment of pain and inflammation. Naproxen prolonged half-life and sustained action make it a popular prescription for chronic conditions like musculoskeletal pain and arthritis. Mefenamic, on the other hand, is usually used for short-term relief, particularly for menstrual pain because of its quicker onset and shorter half-life. Though their pharmacokinetics and clinical uses vary, both medications work by inhibiting COX enzymes to lower prostaglandin synthesis. Patient counseling, which includes instructions on dosage, duration, possible side effects, contraindications, and drug interactions, is crucial to ensuring safe use, proper storage, and adherence to medical advice further enhance the safety and effectiveness of this medication. Understanding the similarities and differences between these two NSAIDs helps in selecting the most appropriate treatment based on the patient's conditions and therapeutic needs.
We discussed on what is this assignment all about and divided the task between the members equally. Referring to the journals and trusted websites, we look for the information regarding the medications and exchange our thoughts about it. As part of our teamwork, we recorded each other explaining the assigned drug information is on our individual tasks. And finally, these are among the references we use. Thank you for watching!